This is Dr. Howard Strassler presenting the e-lecture Pulpal Protection, Bases, Liners, Sealers, Caries Control. Module B, Biomaterials. Now, there are a variety of different biomaterials that are used for sealers and as liners and bases, and I'll be presenting you the biomaterials that we're using in the clinic at the University of Maryland. First, there are the cavity sealers, and by definition, cavity sealers are very thinly placed, typically liquids, and you're looking at 4 different unique products that we're using. One, a cavity varnish barrier, which is a synthetic resin that's been dissolved in a organic solvent, and we use that with amalgam. With composite as adhesives, we use Scotch-Bond Multipurpose, which is a 4th generation bonding agent, which is used with phosphoric acid, so it's an etch and rinse 4th generation bonding agent. We use Optibond Solo on the lower right hand side, which is a 5th generation etch and rinse adhesive. And then there's Xeno 4, which is a self-etch resin adhesive, and all 3 of these resin adhesives are used with our composite resin. Scotch-Bond Multipurpose can be used for bonding amalgam using its chemistry in a unique way, and we'll be describing that in a lecture in the future. So we describe cavity sealers as providing a protective coating, a seal for freshly cut tooth structure in a cavity preparation. They provide a transition between the cut tooth and the restorative material. There are 2 forms, cavity varnish, which is a natural gum or a synthetic resin dissolved in an organic solvent. We use varnishes with amalgam only. We can use a resin-based adhesive sealer, our bonding agents. When we talk about contemporary adhesives, the bonding agents that we're using, we classify bonding agents based upon the number of clinical steps and the adhesive strategy that we're using. For the resin adhesives that we're using at University of Maryland, we're using both etch and rinse adhesives, also known as total etch adhesives, or self-etch adhesives. Etch and rinse adhesives are typically referred to as 4th or 5th generation bonding systems, self-etch 6th or 7th generation. And I refer you to the readings on resin adhesives by Strassler and Sensi that describes these. We also can place adhesives as glass ionomers. Resin-modified glass ionomer materials are adhesive to tooth structure, as are conventional glass ionomers. Cavity liners, and typically the cavity liner that we're using is calcium hydroxide, DiCal, a paste-paste system, and we use it to assist in the formation of reparative, reactionary dentin, secondary dentin. It does this due to its high alkalinity and its antibacterial, antimicrobial effect. It's best used for direct pulp capping, and we use only a very small amount when we place it. In the future, you'll see other materials used in place of calcium hydroxide that have that calcium hydroxide available over a longer period of time due to an extended setting reaction. Other cavity liners include resin-modified glass ionomers. In our clinic, we use Vitribond, an RMGI, resin-modified glass ionomer. Its unique properties include a chemical bond to the tooth structure and fluoride release. Resin-modified glass ionomers are chemically compatible with composite resins. When we're placing cavity bases, and to differentiate a cavity base from a cavity liner is thinly placed, a cavity base is thicker, half to 1 millimeter in thickness, that we're generally not using them for a therapeutic effect. The calcium hydroxide gives us therapeutic effect. It provides primary sealing of the dentin due to the adhesive nature of the glass ionomer, and we use it to prevent postoperative sensitivity, generally with posterior composites. Our material of choice as a cavity base or liner is a resin-modified glass ionomer. When we're using a restorative glass ionomer, either the Fuji 2LC or the Fuji 9, and Fuji 2LC is a resin-modified glass ionomer, Fuji 9 is a conventional glass ionomer, that it's applied and mixed in a pre-made capsule that's mixed on an amalgamator on a triturator, and then we dispense it using an applicator, a gun-like device, through the narrow tip and nozzle into the cavity preparation. Our primary use as a liner base material in thicknesses of 0.5 millimeter or more are to block out undercuts and cavity preparations for indirect restorations such as crowns, inlays, or onlays. When we're dispensing and mixing these glass ionomers, and our focus will be primarily on Fuji 2LC, Fuji 2 light cure, meaning that even though it goes through a self-setting reaction when we mix it together, we can get a snap set by light curing this material. Its primary use is for class 5 caries and for non-carious cervical lesions, class 5s. But we also can use glass ionomers for caries control and as a cavity base. Glass ionomers fall into two primary classifications. Conventional glass ionomers, which have no resin in them, are basically an acid-base reaction. Typically, we're using an aluminosilicate glass powder mixed with a polyacrylic acid liquid. We can mix it with a powder paste on a mixing pad, but typically it's mixed using a pre-made capsule mixed on an automatic high-speed mixer. Our conventional glass ionomer is Fuji 9, and Fuji 9 is typically used as caries control or as a temporary restoration when we're placing a direct restorative material. We either run out of time or we're doing multiple teeth. Resin-modified glass ionomers are reinforced glass ionomers. We talk about it being the Fuji 2LC, used predominantly for class 5s. Its primary setting reaction is also an acid-base reaction in the absence of light, but 10% of this material is resin that can be photoinitiated, can be light cured. We use the Vitribond, which is a resin-modified glass ionomer, as a base liner. We can use the Fuji 2LC for class 5s, but also as a base material to block out undercuts with indirect laboratory fabricated restorations. When we look at resin-modified glass ionomer, as I mentioned earlier, it's an acid-base primary setting reaction, but it's dual cure, with 10% of it being a light-cured resin. Fuji 2LC has fluoride release to the adjacent tooth structure. It's dispensed as a capsule that's activated and then mixed on a triturator. Use an applicator syringe to place the ionomer into a tooth preparation, and we've got to use the correct gun to place it. Different companies have different guns, different manufacturers. It's self-adhesive. We do not acid etch with a phosphoric acid. We do not acid etch for glass ionomer replacement. We instead use a cavity cleanser, a 10% polyacrylic acid that cleans the cavity but does not etch the cavity preparation. Glass ionomer has a unique adhesion mechanism. It does it through a chemical ionic bond between the calcium in the tooth structure and the phosphorus within the material. The fluoride release can be of the material on the surface can be recharged using a fluoride-containing toothpaste or even a fluoride-containing mouth rinse. Because a glass ionomer that restores a class 5 is going to be abraded with a toothpaste and toothbrush, removing that fluoride-rich layer. The fluoride then gets incorporated into the adjacent tooth structure, and the glass ionomer gets used up. A glass ionomer can be recharged from the fluoride ions that are present, as I mentioned, in toothpastes and mouth rinses. So the glass ionomer is a self-adhesive material that bonds through an ionic bond. It actually chelates the calcium within the enamel and dentin. The resin-modified glass ionomer we use as a restorative material in the clinic is Fuji 2LC. It's available in multiple shades, and the typical shades we're using are A2 and A3 and A3.5. It's typically not as aesthetic looking as composite. It's a little bit more opaque. And we use a specialized applicator gun that's for the glass ionomer capsule. To use the glass ionomer and to activate it, we're going to take the glass ionomer capsule, lay it flat on the on your paper barrier that's over your cart. You're going to press in the surface so that it's flush. Once it's pressed in, we're going to take the capsule and insert it in the applicator gun. So here we're looking at the capsule, pressed down and activated, placed in a high-speed mixer and mixed in the triturator for 10 seconds. You've just heard the lecture, the e-lecture on pulpal protection, bases, liners, and sealers, and caries control, and the biomaterials that we use for these uses.